Hi everyone, my name is Dr. Stephanie Weyrauch. I am a physical therapist in Orange, Connecticut at Physical Therapy and Sports Medicine Centers. Just want to tell you a little bit about myself before we start our topic about incontinence. Incontinence is something that in the public we don't really talk about. It's an issue that people think is embarrassing, and so you don't really hear a lot about it amongst your peers or even with your friends. But it is a really important topic because pelvic floor dysfunction can also be connected with other problems like low back pain, sometimes weakness in the abdominals. So these are all things that I'm going to talk about today that will hopefully help. You'll be able to take away some things that you can maybe change about your life without seeing a physical therapist. And if some of these are hard for you to adapt, potentially seeing a physical therapist may help you. It's a condition that a lot of people don't think that don't know that physical therapists can treat. And it's very common, but just because it's common doesn't necessarily mean it's normal. And that's kind of the take-home message that I hope you all get from this talk today. I hail from the great state of North Dakota. I've been practicing for physical therapy now for about 5 years. My husband and I moved out here 2 years ago when he started residency at Yale. I got my doctorate of physical therapy and my master's of science and clinical investigation from Washington University in St. Louis. Did my undergrad in biology at University of Mary in Bismarck, North Dakota. And I consider myself a general practice physical therapist. So when I worked in my last practice before I moved to Connecticut, I worked in a very rural area, a town of about 8,000 people, and our closest city was 5 hours away. So we would have people come from 2 hours away to come see us at our clinic. And one of the needs that I noticed in our community was pelvic health. There were a lot of people that came in with pelvic floor dysfunction, and there was no one around to treat it. So that's when I went on to do some postgraduate work in pelvic floor. And so it's a condition that I really like to treat. I also have a special interest in low back pain and cancer rehabilitation, which a lot of times is very connected with pelvic floor, especially if somebody's undergone cancer treatment in the reproductive area. So that's a little bit about myself, and I work in Orange. So there are a lot of different conditions that have to do with the pelvic floor that can lead to incontinence and can be treated with physical therapy. Pelvic organ prolapse is a condition that can lead to incontinence, and what prolapse is basically the uterus or the bladder can start to fall out of the vagina and can create problems, and that is caused by pelvic floor weakness. So that's something that a lot of times if you go see your OBGYN, they'll say, oh, it's just a part of aging, it's a part of being a woman. Well, that's not always the case. There are things that we can do to treat it. And we'll talk a little bit about that today. Stress and urge incontinence is the topic that we're going to focus on today. I'll tell you how those two are different and how we can treat them in physical therapy. We can treat patients who have had babies or right after they've given birth or even before birth. In fact, the American Academy of Obstetrics and Gynecologists recommend that women should now get physical therapy in their 4th trimester or after they have their baby. So that's a recommendation that physicians are making. Diastasis recti is a condition in which after somebody's had a baby or if you've lost a lot of weight, the six-pack muscle that we all have, especially that you see on really buff guys, that six-pack muscle can separate and cause stretching within the abdomen, and some of that can lead to weakness within the pelvic floor. And we'll explain how the abdominals are connected to the pelvic floor today. And then, of course, pelvic pain and vaginismus are both painful disorders that can also be treated with physical therapy through some of these exercises that I'll talk about today. So who is suffering from urinary incontinence? Well, it's, like I said, a very common problem. You're not alone if you suffer from it or if you know a friend that suffers from it in having this condition. 25 million people in the United States have urinary incontinence, and most of them are women. And again, because it's common, doesn't necessarily mean it's normal. There's steps that you can take to try to decrease your incidence of incontinence, or that you can eliminate incontinence. 1 in 4 women over the age of 18 have some type of involuntary leakage. And the most prevalent form of incontinence that we see is stress incontinence. As you get older, urge incontinence becomes more common. It's more common in women than men, and the primary risk factors are pregnancy, childbirth, and menopause, much of which many of us have already been through or are currently going through. So what's the pelvic floor? A lot of you have probably heard the expression pelvic floor. So what is it? The pelvic floor are the muscles and organs that are basically like a hammock in your pelvis. And what they do is they hold up a lot of the pelvic organs. They are part of a group of muscles called the core, which is made up of the abdominals. One of the abdominals specifically is what I like to call the corset muscle, called the transversus abdominis. It starts in your low back and it wraps all the way around to the front of your belly, and it basically helps to stabilize the spine. You also have little bitty muscles that attach to each one of your vertebrae in your back called the multifidi, and those muscles are very commonly atrophied or weakened in people with low back pain. So a lot of times if you have low back pain, it's very common that your pelvic floor dysfunction will also be affected, and vice versa. And then the last muscle that is a part of that is your diaphragm, which is your breathing muscle. Together, these muscles all make a pressure system that allows our body to, if you've ever been constipated or really had to go poop, number 2, you bear down, you can feel kind of that pressure kind of push down against your pelvic floor. So that would be an example of using those muscles to kind of increase pressure so that you can defecate or go to the bathroom. The role of the pelvic floor is fourfold. The first one is to support the organs. So like I said, the pelvic floor muscles, they cover the entire bottom of the pelvis, and they're made up of pelvic floor muscles and hip muscles. So a lot of times if those hip muscles are really tight, it can affect the support of some of those organs, like your uterus or your bladder. They have a sphincteric function, which means they help you go to the bathroom. They provide stability to your lumbar spine, so they can help prevent or alleviate low back pain. And they all, of course, have a sexual function. So when a person orgasms, those pelvic floor muscles contract and allow somebody to experience orgasm. So here's a quiz for all of you. What do you guys think is the normal frequency of urination? What would you guess for an average person? 4. That's a great guess. Anybody else have a guess?
Depends on how much you drink.
3.
Depends on how much you drink.
Depends on how much you drink. So the average, kind of what we like to see, what we consider normal, is 4 to 8 times per day is average as far as how often you go to the bathroom. And yes, it does depend on what you drink, and we'll kind of get in a little bit more into that later on in the talk. Now the question is, how often, you can ask yourself this, you don't have to blurt it out, but how often do you go to the bathroom during the day? Are you within that normal range, or are you outside that normal range? If you're outside that normal range, you likely could be diagnosed with incontinence. Another question that people have is at night. How often, is it normal to go to the bathroom at night? If you're under the age of 65, we say that at least one time a night is okay. If you're over the age of 65, 1 to 2 times per night is okay. But anything more than that is not considered normal. So that would be another incidence of potentially having incontinence. How many hours is normal to go in between bathroom breaks? What would you guess to that one? Anybody? 2? Anybody else have any guesses? So it can range anywhere from 2 to 6 hours, again, depending on various circumstances that we talk about. Oh yeah, of course. There we go.
Thank you.
Yeah, sorry about that. So some of the things that we do on a day-to-day basis can actually increase our risk for incontinence or feed into some of the incontinence that we may experience during the day. The first one is delaying toileting too long. So I don't know how many of you have been on a really long car ride and you really don't want to stop at a rest area, so you like try to hold it as long as you can. Your brain is actually in charge of telling you when you need to void, and you as an individual that's conscious can decide, well, now is a good time or now is not a good time. So if you delay it too long, you're almost overriding your brain's ability to kind of talk to your bladder and to let you know when is the right time to go to the bathroom. I don't know how many of you have been to Grand Central Station and had to go to the bathroom, but it can be pretty disgusting. So, our first reaction is to squat down and not touch the toilet seat when we go to the bathroom. That's actually something that we do not recommend as physical therapists. And the reason is because it causes your pelvic floor muscles to stay contracted and to tighten. So if you're constantly hovering over the toilet, you're feeding into that tightening and that weakness of the pelvic floor. In order to go to the bathroom, your muscles have to relax. And if you're hovering, they're not able to relax. Do you have a question?
Well, I just want to comment, because sometimes those toilets are soaked. People don't wipe them. I guess they hover over them. That's the problem.
That could be the problem for sure. And there is types of incontinence that have to do with streaming as well. So potentially they could be suffering from some type of incontinence as well. But that's a great question. For those of you on the recording, the question was, the toilets are typically dirty and people have spray on them. So they're probably hovering, and I would agree with that statement. Oh, sorry.
Sorry.
I'll maybe move back.
Yeah, there you go.
Is that better? Okay.
Perfect.
So in some cultures, it's actually more natural to actually do a full squat to go to the bathroom. My mom grew up on a farm where they didn't have a toilet until they were age 10, so they used an outhouse. And so she was literally squatting down like this to go to the bathroom sometimes. And this is actually when your pelvic floor is most relaxed, when you're in a full squat. And there are even cultures where they will give birth in that position. And the reason is because your pelvic floor is most relaxed. So I would encourage you that if you are grossed out by toilet seats, either use toilet paper to sit on or use the protectors, or just suck it up and maybe bring that. Everybody probably has a ton of hand sanitizer and wipes with them, so maybe you can just take care of that afterwards. Bearing down to initiate or complete urination is also something that we would discourage, again for the same reason as hovering. You're actively contracting those muscles, and when you go to the bathroom, you want to relax those muscles. A lot of us are in a hurry on a day-to-day basis. We maybe only have a couple seconds that we actually have to go to the bathroom, and we really have to go bad. So we quickly sit down on the toilet. Oh, that's good, and then we run out. We would encourage you to not do that. Give yourself bathroom time. Allow yourself to fully empty your bladder so that your muscles can relax. My mom does this all the time, going to the bathroom just in case. Oh, I'm going to a movie. I better go to the bathroom before the movie starts. Or, oh, I'm going to this workshop. I better go to the bathroom before it starts. We would encourage you to not do that as well, because again, your brain is the one that actively decides, okay, it's time to go to the bathroom. And if you're overriding that and going to the bathroom when you don't have to go, your brain is going to acclimate to that, and then that frequency of urination is going to occur more often. And you're going to get more symptoms of what we'll talk about next, which is urge incontinence. And then finally, failing to wipe correctly from front to back after a bowel movement can put you at risk for incontinence. And that's because you're at increased risk for an infection, urinary tract infection. So what is urinary incontinence? Well, the definition of incontinence is it's basically an involuntary loss of urine. So something that you don't plan to happen. There's many types of incontinence, but we're going to talk about the three most common today. The first is stress incontinence, and that's with a loss of urine with physical exertion. So that would include a cough, a laugh, getting up really fast, jumping, a sneeze. Those are all common symptoms of stress incontinence. Urgency incontinence is a loss of urine when you feel like you have to go to the restroom. So I don't know if any of you have seen those commercials of gotta go right now. That is a commercial to stop urge incontinence. And a lot of times when you have urge incontinence and you go to the bathroom, you find out that you really didn't have to go to the bathroom that much. And so when we treat that, it's a lot of reprogramming of the brain, which we'll talk about in a little bit. And then finally, mixed incontinence. And that's just a combination of stress and urge incontinence together. So you can have symptoms of both. What is the cause of urge incontinence? Well, the cause is typically due to tight pelvic floor muscles, which cause increased urination. It also affects kind of that connection between the brain and the bladder. Your bladder contains receptors that communicate with the brain. When the bladder is stretching, tells the brain that you have to go to the bathroom. Triggers for urge incontinence include running water, turning a key in the door, so it's called lock and key syndrome. You always go to the bathroom when you go home. So once you put that key in the door, oh, I gotta go to the bathroom, because your brain knows that's what you do every time. It's pretty smart. And then seeing a toilet. Those are all examples of urges. And these are reprogrammable. Your brain is what we call plastic, which means that you can kind of be in charge of changing how your brain thinks about things. So the bladder is made up of a bunch of receptors that communicate with your brain, that tell your brain, okay, it's time to go to the bathroom. When your bladder is about 40% full, that's when you get the first communication from the bladder to the brain saying, hey, we're starting to fill up, you might have to go to the bathroom soon. A lot of times your brain can disregard that message and can say, well, it's not a convenient time right now, or I don't really want to go to the bathroom, so I'm just going to hold it. And then that sensation goes away. Once your bladder gets about 60% full, that's when you start to think about like, oh, I probably should really find a bathroom right now. So you become a little bit more aware of that signal. When you really have to go to the point where you feel like you're not going to be able to hold it anymore, typically your bladder is about 90% or higher full. So your bladder can hold a lot of urine. And then once you decide to go to the bathroom, what happens is you sit down, your bladder, the muscles in your pelvic floor start to relax, and then voila, you went to the bathroom. When you have stress incontinence, what happens is that your brain can't necessarily communicate well with your pelvic floor muscles. And so what happens is when you have that sudden, let's say, cough or sneeze, the pelvic floor muscles will automatically relax, and that's when you get leakage. And so retraining that is more of an issue with reprogramming the pelvic floor, whereas urge incontinence is more reprogramming the brain with a little bit of strengthening to help you kind of hold those urges if you have to go to the bathroom. Any questions so far on how the bladder and the brain are connected? Okay. So how can we retrain our bladders? Well, one of the things that I would recommend that you do is to avoid what my mom does, which is just avoid peeing just in case. Let your bladder be, or let your brain be the guide. If you have to go to the bathroom, if you don't have to go to the bathroom, just don't go to the bathroom. Wait until you have that urge. Make sure you drink plenty of water, but try to avoid drinking water 2 hours before you go to bed, especially if you're having problems with nocturia or peeing while you're needing to go to the bathroom at night. However, the reason we want you to continue to drink water, a lot of people that come see me in the clinic say, well, I don't understand, like, why I have to go to the bathroom all the time? I never drink any water. Well, water is good for your body. Your body is 70% water. So you need that water to rehydrate yourself. And it also helps to kind of let that message from your bladder to your brain connect better. So you actually have more control. What we want you to avoid are what we call bladder irritants. So that would include caffeine, soda, and alcohol. And the reason we want you to avoid that is because they can dehydrate you and they can cause your brain's connection to your bladder to not be as efficient.
So how like alcohol, if you have a glass of wine with dinner, you're saying avoid it. You're not saying avoid it all.
Yeah, I'm not saying avoid it all the time, but I mean, for me, I like drink 6 cups of coffee a day. So if I were talking to me, I would probably say don't drink 6 cups of coffee a day. Right. I would say maybe decrease that to 3 to 4 cups of coffee a day. So obviously, you know, cutting things back cold turkey is always difficult. We want, a lot of this, as you'll see, is a lot of behavioral changes. And the most successful way to be successful at behavioral changes is to gradually reduce intake. So when it comes to, let's say, alcohol, 1 glass of wine a night is totally fine.
At the time before bed doesn't matter.
So we would recommend to avoid drinking 2 hours before you go to sleep, especially if you have symptoms at night of incontinence. And that way you're not feeding into some of that extra that extra signal that your bladder needs, basically, and that your brain sends to your bladder. Does that answer your question?
It does. Can I ask another question?
Yes, of course.
People don't mind. But, I had a book group and we're reading the book Why We Sleep, and we're talking about drinking water and sleeping well and so forth, amongst a lot of other stuff. But I have lead cramps at night, and a couple of the people said, well, you should drink lots of water before you go to sleep. That will avoid the lead cramps. But now I'm not supposed to drink lots of water.
So you're supposed to drink lots of water, just not 2 hours before you go to bed. Okay. So the key to that is making sure you're being hydrated throughout the whole day. So there's 3 things that can lead to leg cramps at night. The first one, yes, is dehydration. The second one is low potassium intake, so make sure you're eating your bananas. Yes. And then the third one can be your nerves. So your nerves cause the muscles in your legs to contract. And if your nerves aren't adequately nourished or don't have enough space or movement, then they can cause muscles to contract throughout the night. So those are the 3 things that can cause leg cramps. The next thing that I would recommend if you're having problems with with incontinence or you want to retrain your bladder is to keep a diary. The reason that I say this is because it's nice to know what your habits are. Again, behavioral changes is understanding what is going on with your body. So if you're noticing that you're going to the bathroom every 2 hours, one of the things that you can do is you can try to change how much time you are taking in between bathroom breaks. So instead of going every 2 hours, maybe you're trying to go every 2.5 hours or every 3 hours. And then that way you're recording and you can kind of see that progress that you're making. So that's why we recommend a bladder diary. And then finally, we want you to stop and resist the urges. Well, how the heck do you do that? Don't worry, I'm going to answer that question next. So urge control and suppression is probably one of the most difficult parts of changing bladder behavior. And it does take time. It's not something that's going to happen overnight. But if you can practice these simple tips, you'll notice a change within a couple weeks. The first one is that when an urge happens and you have to go to the bathroom, stop what you are doing and do one of two things. Either sit down or stand with your legs crossed. Now, there is a reason that little kids stand with their legs crossed. It is because it helps keep your pelvic floor muscles contracted. Now, we know that when you go to the bathroom, your pelvic floor has to relax. So it's either stop and sit or stop and stand with your legs crossed. Do not rush to the bathroom. That is the last thing that you want to do. One of the things that can increase urge is anxiety. So if you're having anxiety, that can also feed in to some of those urges. So the next step would be, once you've stopped what you're doing, you've either sat down or crossed your legs, is you need to start taking deep breaths and calming your nervous system or calming yourself down so that you're not having that anxiety. And then you're going to perform 3 to 6 contractions of the pelvic floor, which we'll talk about a little bit later, to try to kind of let your muscles know that you want them to stay contracted, okay? Then you want to distract yourself from the fact that you have to go to the bathroom. So whether that be counting to 10, counting to 100, thinking about what you have to make for dinner that night, whatever it is, try to distract yourself. Wait until the urge is decreased. Once the urge has decreased or surpassed, then you get up or uncross your legs and slowly walk to the bathroom. And I don't mean like that. I don't mean Baywatch style. I mean just like don't run to the bathroom. Just walk normally. And that will help retrain your brain to make it to the bathroom. Now, if you're really having problems with urge incontinence, we want you to practice this in a safe environment, so at home. Obviously, if you're in the middle of public and you're going to a really important meeting, we don't want you to have an accident or something before that meeting. So practice this at a safe environment. Once you feel like you've got it down, then you can start practicing it in more public places. In physical therapy, one of the things that we do besides helping you with these behavioral changes is we help teach you exercises that will stop incontinence. So incontinence occurs because you have a relaxation of the muscles. So we help try to get your muscles to contract better. The first and most popular one is the kegel. The kegel is performed wrong by most people. Nobody can perform a kegel wrong, right, unless you are taught properly. So I'm just going to explain it to you, and you can think about it. But when somebody performs a kegel, we should not see any movement. Nobody should know you are performing a kegel. Your quads shouldn't tighten, your butt muscles shouldn't tighten, your belly shouldn't move. Basically, how you perform a kegel is you think about lifting up your cervix up to your belly button, or if you're in a really crowded elevator and you have to toot, trying to hold in that toot, thinking about those two things. Those are common cues that we give people. Most of the time when I tell somebody to do a kegel in my office, they perform it wrong, and it typically takes me about 10 to 15 minutes to really teach them how to do it. So it is a difficult exercise to perform correctly. The other exercise that can help stop incontinence is diaphragmatic breathing. So I told you that one of the things that can increase an urge is anxiety. One of the things that can decrease anxiety is taking deep breaths. Meditation is kind of what people are doing nowadays for that. Also, the diaphragm is a part of your core. So if you can get that core to activate, a lot of times the nerves that are connected to the diaphragm are also connected to the other parts of your core. So you're able to activate some of those other muscles. Bridges, does anybody not know what a bridge is? Okay, so I'm going to perform it for you. This is why I did not wear a dress. So a bridge is basically lifting your bottom up and coming back in. For those of you that are watching this on video, I know you couldn't see me, but we can provide copies of that exercise for you in this talk. So a bridge activates the pelvic floor, the abdominals, and the glutes, and the back muscles. So again, we're activating all those core muscles. Squats with a kegel is also an exercise you can perform. Well, if you can't do a kegel, it's really hard to do a squat with a kegel. So that's a more advanced exercise. Walking is great because when you walk, you're using a lot of muscles in your body. And that's one of the distractors that people can sometimes use if they have to go to the bathroom. And then in physical therapy, we can teach you a variety of core activation exercises that are maybe more isolatory to the different muscle groups that we potentially see are weak when we examine you. So pelvic stabilization kind of goes with core activation. And basically what pelvic stabilization is we're activating that corset muscle to work and to try to get the pelvic floor muscle to also activate. And there's a lot of different ways that you can do it. That bridging exercise that I just showed you is one way. Another way is to think about just pulling your belly button in and breathing out of your mouth like you're blowing out a birthday candle. And what should happen is your belly should stay flat. It shouldn't push out. If your belly pushes out, then you're activating more of that six-pack muscle, and that muscle does not function with the pelvic floor. You want to try to keep the belly in. So we talked already about Kegel exercises. Basically, how you perform the Kegel exercise is you want to think about lifting your cervix or your vagina up towards your belly button, or you want to think about holding in gas. Those are kind of the easiest cues that I have found have helped people perform that exercise. You should not feel any other muscles tight. If you do, you did it wrong. So how can physical therapy help with the pelvic floor? Well, we talked a lot about behavioral changes. We talked about exercises that a person can do. But what happens when you come to see a physical therapist for a pelvic floor problem is that we do a movement-based exam. So I had mentioned that a lot of times people will tell me that they have a history of low back pain. And sometimes that low back pain can be feeding into the pelvic floor problem or vice versa. And so I will also typically assess how their back is moving. I'll assess some of the muscles associated with that. I'll look at their breathing to try to figure out, is there a connection or some weaknesses that we can maybe potentiate here. We treat, again, I'm a general practice PT, so I pretty much see everything from people that have neurological conditions to people who have sports injuries and low back pain. But physical therapists can pretty much help with many different types of conditions. And in Connecticut, we're really lucky because we have something here called direct access. And what that means is that you don't need a doctor's prescription to come see us. So you save time and money for most insurances. If you have Medicare, you do. And if you have Yale, you do. And there are some other insurances that may or may not. But a lot of our offices, like Heather said in the beginning, we always call your insurance company to find out your benefits first. And my experience has been that if you're having difficulty with any of these, and you are on Medicare or on Yale, a lot of times your doctor, especially if you have a general practitioner who knows you, will just send over or fax us over a referral. So then you typically don't even have to see them. And then this slide just talks a little bit more about direct access, how it can save you an extra doctor's visit, how you don't need a referral for PT, and how it can help you heal faster and get the care that you need quicker. If any of these things are things that you try and you don't really find much success with improving your incontinence, you may want to consider seeing a physical therapist. I truly believe that the reason that I'm a PT is to help people improve their quality of life. And nobody should have to live with incontinence. You are not stuck like this. This is not something that you need to have in your life. We can help you at least decrease how much it affects you. So I will take questions at this time. And if you have any questions for me or you want to ask me afterwards because you don't want to ask in front of anybody else, that's great. And I thank you for joining us today for this talk.
Thank you.